You're watching WPBF News 25 with Tiffany Kenny, Kristen Hoke, Lisa Hayward, and Weather First with Mike Lyons. WPBF News 25 continues.
And hair repair. 1 year after our own Jim Abbott had his surgery, we'll see how it's looking.
Your news starts right now.
This is WPBF News 25 at 11, where you come first.
Coming up, an amazing transformation. Our own Jim Abbott has a fuller head of hair than he used to. We'll check in to see how his surgery went 1 year later.
Gone today, hair tomorrow. Well, that's a twist on the old saying, but it's not only possible, it's happening.
You can get your hair back, and we can prove it.
Our own Jim Abbott jumped in the hair restoration program last year, and now he's back with lots of locks. We cannot believe all the progress.
Well, you get so used to seeing it all the time, but when you really look back at the pictures from last year, I mean, there wasn't much hair here in front, and I was sure I was going to be bald in about a year or so. So I decided to jump into it, and contrary to popular belief, it's not hair plugs. It's not hair pieces. It's actually transplanting the hair from the sides and back of your head to the front. Now, we followed two other gentlemen as well, Doug and Bill, who you see. All of us are happy. We're very confident, and I think we can show you there is hope. You can get it back.
All right, have you look straight into the camera, and then tilt your chin up about halfway.
For a change, they don't mind having their picture taken. They look great and they feel great, but some people don't know why.
People who I haven't seen in years may walk up to me and say, wow, you look different. Something's, have you been working out? Have you, you just look, I can't put my finger on it.
I go out sometimes with my friends and we make jokes about it. And you try to guess what I did and they can't figure it out.
What Doug Cochrane and Bill Schneider did was get a hair transplant. Dr. Alan Bauman surgically removed hair shafts from their scalps and implanted them in front and on the crown. For Bill, who had tried all the potions and shampoos that didn't work, it was an easy decision.
Listen, I have two little boys. I want to look like their father, not their grandfather.
But Bill's wife?
The first I thought was crazy. I told him I don't mind. I think you're great anyway.
So Bill moved forward last year with his second transplant. So did Doug this year. And now since they did, everyone wants to know. Did it hurt? When you went through, be honest now, when you went through all the...
That's a great question.
I mean, did I sleep sound that first night? No, of course not. But, I had some painkillers and stuff, which helped me relax. And the first 3 days was probably just a little bit of mild discomfort. But after that, I felt fine.
And a year later, he felt a lot better when he saw this.
Better than what I could have ever expected. It's filling in. I have to go get my hair cut every 2 weeks now. It's unbelievable.
And now Doug, before and now, a year after his first transplant and 3 months after his second.
You'll see half of the results in 6 months, but already the growth from the first transplant is huge.
It's been a huge difference. I can certainly tell where I was before through looking at past photos. You can definitely see the progression.
Which is why I gave it a try a year ago.
So you've got some of these lonely soldiers here left in place, kind of holding that front line.
But after 2 sessions and 3,800 transplanted follicles, just a little bit different.
We reinforced the troops up there. You'd be hard-pressed to find, if you look at your hairline, where those single follicles were growing from your old hairline.
And as the old saying goes, only your hairdresser knows.
There was no really hairline in the very front. Right. It was way back. And back in here, there was no hair whatsoever. And each time you have a procedure, it just doubles.
You really going to charge me the long hair charge now?
Yeah, we have to thin it out now, so it's extra money.
That's due in part to a multi-therapy approach, the transplant, propecia, and Rogaine or minoxidil.
Minoxidil is like the caffeine and sugar keeping those follicles growing. Propecia is blocking the trigger for male pattern hair loss, the DHT, which typically causes the miniaturization of follicles to occur. So if you use them together, you get a synergistic response. Chin down just a smidge, yeah.
I noticed more hair and thicker hair in 2 months with propecia and minoxidil before the results of the first transplant kicked in. With the transplant, you see half of the result in 6 months and 90% in 1 year.
If you do those things correctly and according to plan, you're going to get the results. And so, yeah, I mean, you guys are on track to getting the results that I expected.
Now, I think his goal is to have hair like yours or someday.
Exactly. Exactly.
Is that going to happen?
Why not?
Was it worth it?
Absolutely. I'm very happy. I'll do it again.
And Doug's not kidding. He does plan to have another one, and so does Bill, so they're going for 3. Now, a lot of times the doctors say that you probably need to have 2 transplants in order to reach your goals. But again, that's up to each individual person, what you're going to be able to do. And what do you think? Now, you've seen it and seen what
Well,
they've
we
done.
love it, you know, and you don't have, you're stopping at 2 because you don't need any more.
No,
you know,
yeah,
love to
and
rub
I
our
think I've
hand.
got pretty thick hair, so it's filled in pretty well.
And you could really get in there and shampoo it well and comb it. It's really nice without
just like
fear.
regular hair. Yeah, it's not going to fall out. It's definitely going to stay, you know, the way that it is. And because it usually takes several months for it to go in, again, 6 months for 50%, it's still going to keep growing in. It's going to thicken up in the front, and it's going to thicken up on the crown.
I just got to ask you quickly, what's Cindy think of it, your beautiful wife?
She loves it, of course. Being the loving wife, she was happy, you know, whichever was.
Yeah.
But yeah, but she sees, and you do feel happy. You do feel more confident. I think a lot of it shows. Now, the one thing, of course, that it comes down to is cost. And, of course, it's not cheap. A lot of people can't afford it. They run anywhere from $4,000 to $12,000, and that is per procedure. Now, a couple of the things you do, and of course, as Dr. Bauman mentioned, there's that multi-therapy. He recommends the transplant plus the propecia plus the Rogaine and minoxidil. You can get good results with the propecia, which runs from 170 to 190, and the Rogaine and minoxidil is about 20 to 40 for a 2-month supply. You apply that twice a day. Propecia is a pill that you take once a day. You might have a lot of questions. If you do have questions about the transplants, propecia, or Rogaine, or any of the many myths that are out there, like wearing hats will make your hair fall out, that is not true. Just email me here at the station at jabbott@wpbf.com. And we really got a lot of people who last year emailed based on the story that we ran then. We'll probably get some more now. A lot of people curious about it. And of course, we had 3 men that we did the story on here. A lot of women are having hair transplants, and it does work.
Interesting.
Well, you look great.
You look great.
Yeah,
We're going to start calling you Fabio.
That's fine. And I'll pay that long hair charge.
All right, Jim, thank you.
You're watching WPBF News 25.